So for historically, we've always done a first and second place for each of the presentations. So for this year, we've tried to give out a little gift as well. Back in the day when we had a lot of money, we just give you money, but we can't do that anymore. But I have a promise gift for everybody. Once the SAGE's manual is published, I will make sure I have the winners' addresses, and you all get a free copy of the SAGE's manual to navigating a successful military surgical career. So for the awards, these have been named awards for a number of years, and I always enjoy reading these because it just reminds me of who came before us and how we have come to where we are. So I'm going to start with the General Surgery Awards. The first place award is named for Adam Vice Admiral retired Robinson. He was the prior Surgeon General for the Navy. Currently is the regional director for the VA in Hawaii. So I'm reading here, Vice Admiral Robinson, native of Louisville, Kentucky, entered the Naval Service in 1977, holds a Doctor of Medicine degree from Indiana University School of Medicine, Indianapolis, following completion of his surgical internship at Southern Illinois University School of Medicine, Springfield. He's the author of numerous presentations and publications. Vice Admiral Robinson holds fellowship to the American College of Surgeons, American College of Colorectal Surgeons, and he's a member of La Société Internationale des Chirurgiens, the Society of Black Academic Surgeons, and National Business School Scholastic Society, Beta Gamma Sigma, and holds certifications as certified physician executive from the American College of Physician Executives. His personal decorations include Distinguished Service Medal, 2 awards, Legion of Merit, Defense Meritorious Service Medal, and Navy Commendation Medal, Joint Service Achievement Medal, and various other campaign awards. Retired active duty in 2011. So the first place General Surgery Award goes to Simple versus Complex Biliary Procedures Performed at a Resource-Limited Military Treatment Facility. And that goes to Dr. Laura Hayda. And we also give out, in addition to a certificate plaque, our SAGE's Military Committee coin that we've designed maybe about 6-7 years ago now. It's been out for a while. The second place award is the Robert E. Lee Award. Brigadier General Robert E. Lee was born in Scranton, South Carolina on September 25th, 1902. Completed his medical training at the Medical College of South Carolina in 1928, followed by his general surgery residency in 1932. Joining the U.S. Army, he later transitioned to the U.S. Air Force Medical Service in 1949, ultimately rising to the rank of Brigadier General before retiring in March of 1959. Throughout his active and retired life, General Lee played a pivotal role in advancing the policies and ideals of the Society of Air Force Clinical Surgeons. This organization underwent significant development from 1950 to 1958, leading to its formal chartering in 1958 at Lackland Air Force Base, Texas. Notably, General Lee was unanimously elected as its inaugural president, leveraging his position as the senior Air Force surgeon in the U.S. Air Force Medical Corps. So the second place award goes to Dr. Hannah Palmerton, outpatient sleeve gastrectomy at a military treatment facility. All right, so for our trauma critical care part, the first place award is named after Dr. David G. Burris. Colonel Burris was raised in Arizona and worked his way through college as an operating room technician. He graduated with a Doctor of Medicine degree from the Uniformed Services University in 1982. After a surgical internship at William Beaumont Army Medical Center in El Paso, Texas, he commanded the 19th Medical Detachment in Gersheim, Germany, which had both a TDA and TOE mission from 83 to 85. His surgical residency was at Walter Reed Medical Center. In 1989, he returned to Germany as staff surgeon at the 98th General Hospital in Nuremberg, where during the Operation Desert Shield, Desert Storm, as chief general surgery, he oversaw the surgical expansion of the hospital to care for patients transferred from the Gulf. Colonel Burris' final duty station was the second chairman of the Department of Surgery at Uniformed Services University of Health Sciences. He served as Chief Military Region 13 of the American College of Surgeons Committee on Trauma, where he supervised over 100 ATLS courses for all three branches of the military throughout the world. Colonel Burris's military award includes the Joint Meritorious Service, Army Meritorious Service with Oak Leaf Clusters, Joint Achievement Medal, Army Achievement with Oak Leaf Clusters, Army Commendation Medal, and Parachutist Badge. Dr. Burris lived in Maryland. His wife, Wilma Lee Evans Burris, and their three children, until his death in 2010 at the age of 55, after he had a hard fight and battle with cancer. So the first place award goes to Dr. Andriy Denetis from the Ukraine for his work on minimally invasive surgery for the management of thoracoabdominal gunshot injury to the abdomen at the level 2 field hospital operating room. All right, and second place for the Trauma Awards is named up under Dr. Peter Ree. He is currently the Chief of Trauma, Acute Care Surgery and Critical Care and Burn Program Director for Surgical Critical Care Fellowship in Westchester Medical Center Health Network. He is Professor of Surgery at New York Medical College School of Medicine. Previously, Dr. Ree held faculty appointments at Grady Hospital, Atlanta, and University of Arizona. During his tenure in the Navy, he was director of Navy Trauma Training Center and attending surgeon at Los Angeles County Medical Center with faculty appointment at University of Southern California. He achieved an appointment as professor of surgery at the Uniformed Services University of Health Sciences. A retired captain in the U.S. Navy, Dr. Ree also spent 24 years on active duty on the battlefield. He was one of the first trauma surgeons to be deployed to Camp Reno, Afghanistan, and recently started the first surgical unit in Ramadi, Iraq. Academically, Dr. Ree received an MD from USU and PhD in Health Sciences from University of Washington and a diploma in the medical care of catastrophes from the Society of Apothecaries of London. He completed his internship in surgery at Balboa and residency in general surgery at University of California, Irvine. Dr. Ree also completed a fellowship in trauma critical care at University of Washington, Harborview. So the second place award goes to Dr. Donahue in the management of small bowel obstruction secondary to malrotation. I just want to thank again all of our presenters. I thought every presentation was excellent. Every year you give us a harder and harder job to pick all of these, so we really appreciate it. And again, we'll have up during the lunchtime sign up for the helping out at the Innovation Center. Dr. Catherine Kammer is down there. Remember, if you sign up, I'll give you a pin, so really good incentive. And yeah, any other questions, issues, please let me know. But it's just for us. Yeah, no kidding. And lunch is outside. You're welcome to bring it back in here, network with each other. One of the greatest things about today and SAGES is that it brings folks from all services all over the world now. So please have a chance to talk to people that you don't know and don't normally see on a regular basis. So see you all back here at 1 o'clock.